All right, hello and welcome, guys, to our Wittmer interview series. Today we have one of our nurse practitioners joining us. It is Mary Jo. Mary Jo, thank you so much for taking some time out of your day today to join us and hang out a little bit.
Well, thank you
Yeah, well, we're excited to talk to you.
for having me.
You've been with the clinic now for a while, so we're definitely excited to learn more about how you got into the industry and some of your specific things that you've helped some of our patients with and stuff like that. So, to get the conversation started, we're going to just go ahead and get to know you a little bit. Tell us a little bit more about why you became a nurse and then ultimately became a nurse practitioner.
Okay. Well, I actually became a nurse later on in life. I went through a divorce, and it was actually in a Sunday school class where you could reimagine your life. And if you could become anything, what would you become? And I recently went through an experience. I had an uncle pass, and I saw how hospice has helped, especially the hospice nurse, not only alleviate his symptoms, but help the family get through everything. And it's like, oh, that's what I'd like to be. Anyway, a year later, I started nursing school and I worked my way up. I became a hospice nurse, and then I went on. I got my master's in nursing education, but I liked patient care better, so I went back and got my nurse practitioners. And that's where we are today. But my specialty is palliative care, which is alleviating pain and suffering. And normal people have a lot of pain and suffering. You don't have to be dying, and that's what I really enjoy is helping people feel better, and I do with
Well,
that.
that's awesome, and I know you provide a lot of value to those patients and to us as a clinic, and so I think it's really cool to get to know you guys a little bit. That is why we're doing this series, so we can kind of put a name to a face and things like that for our patients. And so one of the questions I did want to ask you is, what made you want to start treating your patients for those hormone deficiencies? What kind of led you down that road? We talked about how you got to be a nurse practitioner. Now, what about hormone deficiencies specifically?
Okay. Well, I found that most everybody, like I said, has some type of pain and suffering. And by optimizing hormones, you can help alleviate physical, mental, emotional issues. And it improves the quality of life, not only for the patient, but for their families having to deal with them. So, anyway, hormone therapy is a great way of doing that. I know that it changed my life for the better, so I know what it can do for people. And I enjoy doing that for everybody else.
Yeah, that's
So
great.
that's
Do
the
you?
main thing. It improves the
Yeah.
quality of life.
Yeah. I know you deal with a lot of patients, specifically probably some patients with hesitancies when it comes to hormone optimization and potentially taking that route. What's some of those conversations that you have with your patients to maybe comfort them? You said you've dealt with your own experiences in this field as well. When somebody's a little bit hesitant when it comes to this stuff, what's some of the conversations you like to have with those patients?
Okay. Well, the hormones that we deal with are the bioidentical hormones. Okay. Molecularly, they are identical to what our bodies produce on your own. Okay. And they've actually been studied to be disease and cancer protective, not causative. Now, hormones have a bad reputation because of the hormones of the past. Okay, they were made from horses, pigs, and cows and given to humans. And they did cause a lot of damage, and they still do. They're still given out by the big pharmacy companies. So we don't deal with the old hormones at all. We deal with the new ones. And they tend to just, we, we supplement what your body already produces. Okay, the hormones are the highest when we're 20, and they go down the rest of your life unless you supplement. So we just tend to supplement and improve everything, how your body works better, and that's what we do. So they're a lot more natural than the ones of the past.
Yeah, I love that answer. I'm always curious what everyone's individual thoughts are, and I think you hit it right on the head. When it really comes to understanding our bodies, which that's what you've studied, it's really cool to hear some insights from somebody like you in that specific field. Another thing we deal with our patients is weight loss, and I know that you specifically specialize in this area as
Mm-hmm.
well. I would love to hear some more stories around the weight loss peptides that we provide, specifically tirzepatide or semaglutide.
Okay. Well, tirzepatide and semaglutide are for, well, they weren't created for weight loss. They're actually created for diabetics. But people lost a lot of weight, and now
Right.
everybody's using them for weight loss. They basically work by slowing the stomach from emptying. So you feel fuller faster. So now I tell everyone to use them as a tool. Okay. I have people that take them, eat just as much as they always did, and then they're not losing weight. So if you consciously eat 75% of what you would have eaten naturally, you're going to lose weight. Plus, they also make your body work better, so it just processes everything you're eating, and you lose weight. One of the best examples I have a guy that started, and he lost 40 pounds in 6 weeks. 40 pounds, and that's just amazing. It not only changed, his looks and made him feel better. He's got more energy, a better mood. He's got his vitality back, and excitement for life, and it's just amazing what can happen. Now, the average doesn't lose it like that. He was an extreme, but the average person on semaglutide, you can lose up to 10% of your body weight. The tirzepatide, you tend to lose 15 to 20%.
Now, correct me if I'm wrong here, but
you have to use it as a tool.
yeah, I was going to say, correct me if I'm wrong here. Now, this is more for people that are severely obese, not somebody who's potentially looking to lose 5 or 10 pounds or something like that. This is for somebody that's severely obese, potentially looking to jumpstart their journey of weight loss to get to the point where they probably could do some more active movement and lifestyle changes and things like that. But that first kind of push is something that they're looking for. Is that correct?
It is, and it's progressive, and it's not fast. Okay. What it does is it does slow your stomach from emptying, so you have to start out with a low dose and build up. If you start out at a full dose, it's going to paralyze your stomach, and it's been on the news. People are suing because their stomachs are paralyzed. Well, duh, that's what it does. So anyway, so you have to build up. You get to a certain point, you start losing the weight. Once you've lost your weight, I also recommend that you wean down the same way that you weaned up, because then that teaches your body to adjust to it, and you have long-term success that way. So yeah, most people are on it for a couple of years if they have 40 pounds to lose, not 6 weeks like this one guy did. So.
Well, awesome. That's great. I saw your face light up a little bit when I asked you about, specifically that gentleman in his story and how he lost 40 pounds and stuff like that. What is the most rewarding part about your job, whether it is, dealing with patients or specific areas of the different routes you are able to go, whether it's hormone optimization or weight loss, things like that. Overall, what would you say is the most rewarding part of your job?
Being able to optimize their health, make them feel better, bring them back to life. Now we do telehealth, so I do see the person, for the first time, but most of the other follow-ups are done by the phone, and I can hear the change in their body, the excitement, their vitality for life again over the phone. Some people you can't, and it's like, okay, let's adjust things a little bit more. But just by optimizing their health, it's truly life-changing for them. And I love helping people, and this is a really unique way of doing it for them.
Yeah. I think me and you are a
So
perfect,
I'm excited about that.
yeah, me and you are a perfect testament to that. And it's really cool to hear
Yep.
that side. So that's awesome. The next thing I'd like to talk about is something a little new that we're diving into at the clinic, and that's going to be our DNA testing. So really excited to have some of this conversation with you. So can you tell me a little bit more about exactly what DNA testing is?
Okay. DNA testing is basically the building blocks you've been born with. It's what every cell in your body is made of. It's how your body processes things. Now, in the past, it's been used to figure out, diseases. Y'all know I have a handicapped son. We did a lot of DNA testing after he was born to try to figure out what happened. Now we are using DNA to figure out how your body processes normal cellular responses. So it can identify the reasons you have chronic inflammation. Chronic inflammation causes a lot of issues. It can cause the diabetes. It can cause dementia. Even your mood, it affects that. So I got involved with GX Sciences through one of the seminars I was going to, got really excited about this. They test over 250 different genomics in your body, and they're able to tell you how that affects the rest of your rest of your body and how it works. So now by learning more about your body and how you respond to everything, you can fix it through supplements and whatnot, make your body more optimized so you have better results all the way around. Not only physically, but mentally, especially.
Yeah. Awesome.
So, anyway, I'm excited to add this testing to our patients because, yes, hormones do help 98% of the patients. We do have some that, even though on paper they look perfect, you know, all their numbers are great, they just don't feel that way. I don't hear it in their voices when I'm talking to them. So there's some reason that their body isn't processing things right. These tests would be absolutely perfect for them. It'll help explain, okay, you have a deficiency in this one gene. That might be why. We give suggestions on supplements that can help fix that. I think we're going to get into offering some of those supplements soon. And it also gives you lifestyle recommendations and education on things you can do to help it without the supplements. But anyway, I'm just really excited for it. We have all kinds of testing that we're going to do. It gets down to even, the mitochondria, which is the powerhouse of each cell. Every person, the average woman has 27 trillion cells in your body.
Oh my goodness.
Every one of those makes a difference. And if they're working at 50%, maybe that's why you're so tired.
Right.
Okay. It even affects your hormones, how your body affects that. And if you can fix that, make your cells become 75% more efficient, you're going to be feeling a whole lot better than that. Now, I have a sample report. Would you want me to show you kind of what it does?
Yeah, I would love that.
Or what it explains? Yeah. Anyway, this is a short, just a part of one. But if you do the testing, you're going to get a report for every test that you get. Okay, on it, these are the genomes that they test. Like I said, there's over 250 that they can test. All right, that comes up with the different colors. If it's green, that means that your cells are working just fine. Okay, that part was doing good. If it's yellow, you've got some deficiencies there. If it's red, it's not working. Okay, so what we do, and then in this column is a suggestion of the supplements and things that you can do to help them work better. And then the example of supplements we're going to offer. Then we have lifestyle interventions, diet suggestions, things like that, exercise. And then we also have, further testing that might be needed, like do your A1Cs, things like that. So it's very informative of that. One thing I also like about this is they give you education so you can know more about it. Okay? They tell you how the DNA works in your telomeres, especially like that. They give you recommendations on diet and exercise. Anyway, it's just really exciting. And this is the most thorough company I've found that does this for us. Now, we are going to be offering consults because it is a lot of information and confusing to understand. And if you've been one of my patients before, I go through your regular hormone testing that we do rather intensely. So I can help interpret what all that means for you.
That's great. Yeah.
On there. So the exciting one that we're going to be doing now, the DNA is everything you're born with. Okay, so you can't change that. You can change how your body processes everything, and you can help it work better with our suggestions. Okay, there is a test. It's called the telomere test. Well, they actually test the telomere. It's called the telo test. But what it measures is the telomeres that are in the body. Okay, everything affects these. Okay, your diet, how much you exercise, environmental factors, like if you've been exposed to toxins, smoking, pesticides, everything like that. So that's what they're testing. You get a report, okay, you'll have your actual age, but you'll also get your telomere age, which is how your body has been affected. Now, this does change, okay? This changes with the improvements that you've done. So you can see where you stand to start with. Okay, this person here is 45. Okay, but she tested to be a 39-year-old.
Yeah.
Okay, so that's good. All right. If you're 45 and you come up as a 60-year-old, that's not so good. That means your cells have been damaged. Now, this test can be repeated because it actually tells you how you've improved. So you can do it every 6 to 12 months, and you can tell if the differences you've made are improving your body. So that's the exciting thing about the telomere test
very cool.
on that. So it's, it's your DNA age versus your actual age on that. Anyway, it's pretty exciting stuff. I get into this.
No, I love it. I think it's awesome. Is there specifically like a group of people, you mentioned the person that maybe is dealing with some symptoms past, just the hormone optimization. Do you have a group of people specifically that you believe that this DNA testing would be for?
Everyone. Absolutely everyone. I mean, it really makes a difference. For diabetes, your mitochondria in your cell, or the stuff that's in your cell, if you're insulin resistant, let's start this. If your mitochondria, which is the recycling part of your cell, is not working right, okay, it creates the energy.
You're good.
Start this part over, okay. Edit this one out. Okay, in your cells, there's the mitochondria. That's the energy producing part of your cell. Okay, autophagy has an awful lot to do with that. Autophagy cleans up the garbage that's in your cells. Okay, a good example is your cells are constantly turning over. If you have dry skin or get sunburnt and you peel off, that's your dead skin cells. Okay, that goes on inside of each cell too. So you have to have autophagy, which is the garbage cleanup, be able to do that. Well, if your cells aren't working properly, that garbage isn't getting cleaned out. Okay, a lot of people are diabetic because their cells are full and they can't accept the insulin in their own body. So you become insulin resistant, or the glucose. So diabetics can do it. Chronic inflammation can lead to a lot of mood disorders, anxiety, depression, the anger. All of that stuff has to do at the cellular level. And if you get your test done and you find out that, okay, you are deficient in some of those, that's a reason. Well, we have things we can do to help you feel better. And it does. I am proof of that. I have done all of these on my own now, and I can tell a difference in just a couple of weeks of using it.
So specifically, what's the method that you guys use for that DNA testing? Is it just a normal blood draw that you would do, similar to the hormone optimization, or how do you guys specifically test for that?
Nope. No blood or needles involved at all. It's just a simple cheek swab. You do it yourself at home. Everything's comes sterile. It's shipped to your door through the mail, regular United States Post Office. And you do it on your own. The only thing is you don't want to eat or drink anything about half an hour to an hour before you test it, so you get all your own DNA. I just did mine as soon as I woke up. You just put it in there, rub it around each side of your cheeks, put it into the test tube, and take it to the post office and ship it back off. 7 to 10 days later, you get the detailed report.
Yeah. And you mentioned you guys are also going to be doing consults with these as well, so you guys can talk through some of the results and the things that you're looking at specifically, and you can help the patient with.
Yeah, it's a lot of information. I did mine, and it was actually 110 pages long, but I did a lot of them. And, it took me a while to absorb what it was and everything, but I've also attended all the seminars and classes, and, so I can teach and, teach you what it means, and then also what you can do to adjust and have your body perform.
So specifically, what are some treatment options that you tend to lean on? You talked a little bit about lifestyle choices and stuff like that, but when you do specifically see some different ailments that come up, how do you address those specifically with your patients?
All right. Well, we talked about the mitochondria. The GX Sciences has created a supplement. There is probably about 20 suggested supplements that are going to be beneficial for you. They have actually created a product that has all of that in it. So you just have to take, one capsule a day instead of the 20 different capsules. One of them is called the PQQ for mitochondria. And what that does is it just helps the energy get made more in each cell. Okay. And it just helps your body perform better. But that's just one of them. That's just one of them. They have a full line of products that can help, with your mood, mainly your energy, your performance, the autophagy. It just, you've got to be specific to you, but that's what these tests are going to tell you, what you're deficient
That's
in and what you
amazing.
need to work on.
Definitely excited to see that and to talk to you more about that in a couple months once we have a couple more patients that you've been able to do this on and move forward with. The last subject I want to bring up, no pun intended, I promise, is ED. That is something that's that has been in the space a lot, especially as of late. I would just love to hear a little bit of your thoughts. I know that's another area that you specialize in as well. Specifically, do you see or have you noticed an increase in patients suffering currently from ED?
Well, yeah. And chronic inflammation can affect that too. Everything, the diabetes, the heart disease, stress, okay, is huge. Yeah, a lot of men are admitting it now. It's more people just didn't talk about it before, and they just didn't deal with it. Well, now there's things we can do about it. The easiest things, is the Cialis. That is a longer acting low dose of a PDE5 inhibitor. What it does is it increases the blood flow to your penis, so you get better erections. Now, I refer to this one as being locked and loaded. It's just a low dose. You take it every day, and it just keeps you ready to go. Okay? You can take a higher dose just on the weekends if you want. That gives you a little boost. But it's not Viagra. Okay? It's a longer acting. Now, Viagra is more of a short acting oomph. Okay? So it gives you that high, and then it's supposed to be out of your body in 4 hours. It's not always. But anyway, so that gives you the 4 hours worth, and then that you just take it as you need it. You only take it once a day though. Okay, no more than that. So those both work the same way with increasing the blood flow. There are men that that doesn't work for. They need more. Therefore, we have some injections, trimix injections, quad mix injections. That's a little more invasive because it is an injection directly into the penis, but it works. It gives you an erection within a few minutes. It lasts somewhere. Again, it's supposed to be 4 hours, but for some it's longer. Now, what I recommend or what I suggest, you need to have Benadryl and Sudafed on hand. Okay, because if it does last longer than 4 hours,
Gotcha.
those will help knock it back down. Okay. Anyway, it's been a benefit for a lot of men. They love it, and it just improves the quality of life.
Yes, for sure.
And their wives too. So there you go.
I know specifically, with the increase potentially in how you guys are adapting the hormones and things like that, that does cause a spike in libido. Do any of these medications specifically change their libido as well, or is that a little more on the other side of things?
Well, testosterone's pretty fabulous, especially for women. It gives you a libido. Like, no wonder guys think about it all the time. I mean, it's pretty fabulous. But for men, it tends to improve them if you're having issues. The first sign that it's working is if you aren't having morning erections, you'll start. Okay. Now, the longer you're on it, the more regular they get, but it does help improve it. But there are people that need something else too, mainly because there's other issues that have affected the blood flow on that. If you are still having issues with libido, we have some other products too. We actually have oxytocin itself, which is the hormone you produce when you have an orgasm. So by taking it, it just kind of gets you in the mood already, which only enhances everything. And I've had some really good response with that. We also have a nasal spray. It's bremelanotide. I think PT-141 is another name for it. And that has been showing wonders too. So even if things are working, but you just don't have the way of
Awesome.
mood to get
Well, thank you so
into
much for your time today, Mary Jo.
Rejuvenation.
You crushed the questions. I know at times it can be a little daunting to do these calls, but I think you do a great job, and I know that your care for the patients is something that means a lot to us here at Wittmer Rejuvenation, and we're just happy to have you a part of the team, and thank you so much for your time today.
Well, thank you.